All right, good morning, good afternoon. We could let people slowly come in here. Thank you for joining us. Happy Friday. Welcome to today's session, Stop Crisis Before It Starts. This is the final webinar in a 5-part series. And if you're just joining today, you've missed an amazing dialogue the last 4 weeks. You could go back and check these out on YouTube. We'll put the link in the sidebar and you can peruse it in your own time. Today's session is all about prevention. It's about population health, going upstream, being in the places that people are before there's a crisis. How can we as a nation invest properly in prevention and early intervention? My name is Dr. Ben Miller, and I'm the Chief Strategy Officer for Wellbeing Trust. It's an absolute honor to have been able to be a part of these the last 4 weeks and now into the 5th week. If you're not familiar with us, we're a national foundation focused on advancing the mental, social, spiritual health of the nation. And alongside our amazing trusted colleagues like the Kennedy Forum, Inseparable, who you'll hear from just a minute, the American Psychological Association, the National Alliance of Mental Illness, and the Education Development Center, welcome to the final and 5th session on mental health policy that we've been hosting. Each of these 5 sessions has been carefully curated to bring the best thought leaders and national experts to the table to discuss concrete ways that we can address our nation's mental health and addiction crisis. And you don't have to look far to realize what a crisis we're in. We've covered crisis response, primary care, mental health integration, workforce, and so much more. It has really been a rich discussion. Our foundational guide that we're working from is the Action Alliance's Mental Health and Suicide Prevention National Response to COVID-19, or affectionately called the National Response for short. The national response lays out 6 priority areas that really lay the groundwork for our country to embrace a much more comprehensive response to mental health and suicide prevention, both during and after COVID-19. If you're unfamiliar with the work, you can check it out anytime, nationalmentalhealthresponse.org. It includes the 6 priority areas. And the topic that we're going to talk a bit about today is priority 6, which is invest in prevention and early intervention approaches that really treat the root cause of suicide and mental health problems. And we have this amazing all-star cast just in the green room ahead of time. It's just so humbling to be with such amazing, trusted partners and friends. So I'm thankful that they're here with us today. So let's get started. I'm actually going to turn this over to one of our all-stars, Krithika Harish, who's an amazing leader at Inseparable. If you're not familiar with Inseparable, they've been a partner with us throughout. They are a new policy advocacy organization doing some pretty interesting, which is probably an understatement, work to really help advance mental health. You can learn more about them at inseparable.us. So my deepest thanks to all our friends who have joined us along the way in this last 5 weeks, to each speaker, our congressional sponsors and partners. These 5 sessions are all available, as I mentioned, online. So Krithika, I will turn it over to you.
Thank you, Ben. Hi, everyone. Thanks for joining. My name is Krithika Harish, and I'm part of the team behind Inseparable. We're called Inseparable to reflect a simple truth, that the health of our bodies cannot be separated from the health of our minds. Inseparable is a new mental health advocacy organization, and we were formed to fight for better mental health care and access for all. In 2021, Inseparable, we've identified 3 urgent policy areas in need for reform at the federal and state levels: increasing access to care, stopping the criminalization of mental illness, and last but definitely not least, the topic of today's conversation, investing in prevention and early intervention. It's my pleasure to introduce our amazing lineup of speakers today. Dr. Arthur Evans is CEO of the American Psychological Association, the leading scientific and professional organization representing psychology in the United States. With more than 121,000 researchers, educators, clinicians, consultants, and students as members, the APA promotes and disseminates psychological knowledge to benefit society and improve lives, a mission consistent with Dr. Evans's life's work. Before joining APA, Dr. Evans in March 2017, Dr. Evans spent 12 years as Commissioner of Philadelphia's Department of Behavioral Health and Intellectual Disability Services. In that post, he led the transformation of that agency's approach to serving a wide range of individuals with complex needs. Prior to his work in Philadelphia, Dr. Evans was the Deputy Commissioner for the Connecticut Department of Mental Health and Addiction Services, where he led major strategic initiatives for the state's behavioral health care system. Dr. Sharon Hoover is a licensed clinical psychologist and professor at the University of Maryland School of Medicine. Division of Child and Adolescent Psychiatry, and she's also the co-director of the National Center for School Mental Health. She currently leads national efforts to support states, districts, and schools in the adoption of national performance standards of comprehensive school mental health systems. Dr. Hoover has led and collaborated on multiple federal and state grants with a commitment to the study and implementation of quality children mental health services. Since 2004, she has worked with the National Child Traumatic Stress Network, Treatment Services Adaptation Center for Resiliency, Hope, and Wellness in Schools to train school district and school leaders, educators, and support staff in multi-tiered systems of support for psychological trauma. Next, I want to introduce Allison Mellman. Allison Mellman is the founder and executive director of Active Minds, the leading organization mobilizing the next generation to change the conversation about mental health in America. With programs at more than 800 high schools, colleges, and workplaces, Active Minds is opening up the conversation about mental health and creating lasting change in that way, in the way that is valued across the country and saving lives. The survivor of her brother's suicide when they were both in college, Allison has since been profiled in Forbes, New York Times, CNN, and more. And she additionally sits on the advisory councils of the National Suicide Prevention Lifeline and Wellbeing Trust. Finally, I want to introduce Sam Brinton. Sam Brinton is one of the world's leading advocates for LGBTQ youth. They are the founder of the 50 Bill 50 States campaign at the Trevor Project to end the dangerous and discredited practice of conversion therapy, first in the United States and then around the globe. As a survivor of conversion therapy, Sam has spoken before the United Nations and Congress, as well as testified on legislation from coast to coast to protect LGBTQ youth mental health. They have been featured in numerous media, including multiple New York Times op-eds, as well as the Washington Post, Playboy magazine, and Time magazine. Sam uses they, them, their pronouns, and as a gender fluid person. So that is our all-star panel for today. You'll be hearing from everyone, but I want to turn to Dr. Evans first. Dr. Evans, you lead the thinking around priority 6 for the national response, investing in prevention and early intervention. Investing in prevention and early intervention that treat the root causes of suicide and mental health problems. I want to turn to you first today to help provide some framing for our conversation. Dr. Evans.
Sure, thank you so much. And I'm very delighted to be here. Priority 6 of the national response is really dear to my heart. I spent 30 years of my career prior to coming to APA, really in the front lines in public policy positions and working in treatment programs. And I would say that the biggest challenge that we have is the paradigm that we have for how we deal with mental health and substance use problems in our country. And priority 6 really speaks to that because it talks about prevention and early intervention. So in order for you to really appreciate why this is so important, let me first explain a little bit about how we approach mental health in this country. And I would suggest to you that, and the way I describe it is that we have a black box mental model for how we think about mental health. And the way it works is that we create a black box. It could be a doctor's office or a therapist's office. It could be a hospital. It could be a residential program. Once that is established, what we ask people to do who have mental health problems is to come to us. We diagnose them. We figure out what's wrong, quote unquote. We treat that, and then we discharge people. Now, we don't have enough time on this program to talk about all the reasons why that model doesn't work for many of the people who have mental health challenges. But let me just give you a few, because I think it highlights why moving and expanding, I should say, to early intervention and prevention is so important. First of all, most people who have mental health challenges don't come to treatment. Only about half, and for some groups, much less than half of people who have a mental health challenge will actually seek out treatment. Often people don't know where to go. Often people are ashamed or they're embarrassed. We have a lot of stigma around mental health issues. And so the first problem is people don't come. This is a passive model that waits for people. The second problem is that mental health issues occur on a continuum. And we treat mental health issues in this country as a binary phenomenon. Either you have it or you don't. You're a part of the group or you're not. The reality is that all of us are on that continuum of mental health, and we move up and down it over the course of our lives. Right now, what the data are showing is that right now, many of us, most of us, in fact, are towards the deep end of that continuum because of the living through the pandemic, all of the stress related to that, the economic stressors, the political stressors, the racial injustice stressors. All of those things are showing up in the data as symptoms that people are experiencing: trouble in eating, trouble in sleeping, trouble, more people using alcohol to cope. That's what our Stress in America data is showing. That's what CDC data is showing. That's what a lot of the data that is out there is showing. So what does that mean? There are many people who are experiencing psychological distress. They may not have crossed that threshold, but because we treat people either you've crossed the threshold or you're not, we're essentially ignoring 75% of the population that may have, and we do know is having challenges. And the other one other issue that I will point out is that because this is a passive model, what it means is that the behavioral health issues in our communities are often showing up in places that are not the most helpful. We know that, for example, if you are a person of color, that you're more likely to be treated in the most acute settings, in hospital emergency departments, in the criminal justice system, particularly for young African-American youth who are often in the juvenile justice system, who have mental health problems, and they're not being treated in the regular treatment system. So for all of those reasons and many more, this passive strategy of waiting for people to come to us doesn't work. And let me actually give you one more, and that is that we wait often for people to reach that diagnostic threshold. And what we do know from a lot of research is that the longer we wait to intervene when people have these conditions, the harder it is to treat. And in many communities around the country, there are long delays for people to get access to services. And there are often, and in most places, people have to be in crisis. So the question for us from a policy standpoint is, how do we move upstream? How do we get to people earlier? And because we actually know a lot about how we can intervene earlier, we know how we can help to prevent people from likely developing deeper end mental health challenges. We're just not doing it. So let me give you a few examples of what that means from a practical matter. And this is tied to the whole idea of a population-based way of working, or a population health way of working. Right now, we're only providing resources for a small percentage of the population. And what we're trying to do is have a whole population approach where we're identifying people who are at greater risk. We know who those people are. We know that, for example, right now, if you are an essential worker, you are experiencing a lot more psychological distress than the rest of the population. If you're a person of color, you're experiencing more stress. If you are a parent who is working with, and you have children who are doing remote learning, very high levels of stress. And if you're a parent who is in that situation, you know exactly what I'm talking about. So there are groups that we know are having higher levels of stress, and there are things that we can do now to help mitigate that and to help intervene much earlier. So for example, one of the things the American Psychological Association did was to develop a toolkit for frontline healthcare workers that was based on psychological science that helped people to do exercises that could help reduce their stress level in the midst of a shift. That's the kind of early intervention strategies that we're talking about. So what do we need to do? There are several things that we need to do. First of all, we need to have much more flexible spending. I was a commissioner for a total of probably about 20 years, 2 different states. And I can tell you that most of the service dollars that we have are tied into fee-for-service for the treatment of an illness. Most systems only spend maybe 2% of their budgets on prevention and early intervention. And so we have to have additional funding for particularly public systems that is flexible, that allows people to do these kinds of interventions that work further upstream. Secondly, we need to make sure that we have strategies that are more assertive going into communities. The problem with the black box is it waits for people to come to us, as opposed to putting resources in the community where people are. And one really important way to do that is through partnerships with between mental health systems and other systems. The policy implication of that is that, particularly at the federal level, we need to have agencies like HUD, Department of Labor, Department of Education, look at their policies through the lens of how can they provide the kinds of supports that people who have behavioral health conditions can access in a more efficient way. For example, one of the things that happens with people who have substance use problems is that they get banned from public housing, or if they have a criminal record, they get banned from public housing. We will never be able to help people in their recovery process if we don't address those kinds of social determinants. So we have to make sure that those policies and those other agencies address those kinds of issues. And then two other points, workforce, really important to make sure that we are bringing into the field people with lived experience, people who can do what is commonly called now task sharing, doing the kinds of interventions that don't require people who have advanced training, but can be very helpful at intervening early. And then the last thing that I would mention is that we have to spend much more resources on children and youth, and you're going to hear more from our other panelists about that. We know that early childhood trauma, for example, is a strong predictor of one's life trajectory, and it certainly impacts on children's ability to learn. In fact, social and emotional challenges are one of the highest predictors of how well children will do in school. And so focusing earlier on children's mental health, ensuring that they are getting the services that they need, and that we are also looking at prevention strategies for that population as well, are really important. So with that, I'm going to turn it back to you, and we can hear from our other panelists.
Great. Thank you, Dr. Evans. And if all the other panelists could come back on camera. Thank you. Yeah, thank you, Dr. Evans, for illustrating the wide range of areas where we need to implement preventative and upstream policies. And also, like Dr. Evans mentioned, a comprehensive approach to youth and school mental health must be a part of our prevention and early intervention efforts. This conversation is especially exciting for me because, in partnership with national and state partners, Inseparable is about to launch a multi-year advocacy campaign to drive public support and political pressure for school mental health policies and to tangibly advance school mental health policies across states in the country. I'm thrilled to be joined today by Dr. Sharon Hoover, Sam Brinton, and Allison Mellman to dig deeper into this topic. I want to remind folks watching that we will have time for audience Q&A at the end with all of our speakers. So please drop your questions into the chat at any time and we'll get to it at the end. Sharon, I want to start with you. Youth mental health is a very broad and complex area, but one important area of focus is the education system, because we know almost all children go through school. So it's a great place to address their mental health needs. Can you talk about the comprehensive school mental health systems approach that you and the National Center have been championing and what that entails?
Absolutely. And first, I want to again lift up a statement from Dr. Evans. I found it incredibly profound. We are ignoring 75% of the people who may be experiencing mental health challenges. We're a passive system. We wait. I found it incredibly compelling. So I'm delighted to be followed by Dr. Evans and just this call to us to move upstream. And that's really where schools come in. So at the National Center for School Mental Health, we've been working with federal and state partners for years to establish establish a framework for comprehensive school mental health systems. So what does that mean? The term comprehensive school mental health systems means providing a full array of services and supports in schools that promote positive school climate, social emotional learning, mental health and well-being, while also reducing the prevalence and severity of mental illness. These systems are built on the foundation of district and school professionals. So that includes administrators and educators. Dr. Evans spoke about task shifting. We have to think about mental health as a shared responsibility of everyone in the school. It also includes specialized instructional support personnel. So that's our school psychologists, our school counselors, our school social workers, our school nurses, and other health professionals, all in strategic partnership with students and families and community mental health and health professionals. And these systems also assess and address the social, political, and environmental structures like public policies, social norms that influence mental health outcomes. So just kind of in brief, what does this look like at the school building level? This looks like a school that promotes the well-being of all students in the school. So this isn't just about those students with identified mental health concerns. It's really all students in the school by offering social emotional learning right there in the classroom. So students learn competencies like self-awareness and social skills, empathy, compassion, competencies that make them good citizens, but also emotionally healthy human beings. It's schools that offer well-being supports to educators who we lose too often from the field due to burnout. It's offering positive behavior interventions and support so that students have a clear and consistent understanding of how to operate in the school building and elicit positive behavior, providing culturally responsive and anti-racist policies and practices so that we can promote all students and staff feeling safe in the school, equipping teachers in that school building with the tools that they need to identify students who have mental health concerns, assessing and addressing those broader social influencers of health, and then finally offering a full complement of mental health professionals, including those school hired and community hired professionals, so that we're really leveraging both the education sector funding and resources and the mental health sector funding and resources.
Thank you, Sharon. Sam, I want to turn to you next. The Trevor Project is the leading national organization providing crisis intervention and suicide prevention services for LGBTQ youth and young people under 25. Could you talk about your approach to schools and what policies and programs you're currently prioritizing and why?
Absolutely. I get really excited when I get to talk about schools because the ability to save lives starts so early. It does not need to be kind of in the moment of crisis that we can put the supports in place so that a person, yes, if you ever are in need of it, we're ready, but that you may never have to need it. You may never get to the point where you feel like you're in super crisis. So I'm going to break down, it's a simple program. It's called the Model School Policy. I am thrilled to say that thousands of schools across America have found this to be a really effective way. It's going to sound a little bit like Sharon's, to be very honest. Welcome to Great Minds Think Alike. But here I will put it in a very inseparable way of putting it. I'm going to relate it all to a doctor visit. Okay, so just like a physical health, I'm going to relate this to a mental health. And this is how we see suicide and crisis intervention as a whole. First, you have prevention. Prevention is this like in school, having the staff, teachers, and students knowing what the warning signs of suicide or the warning signs of crisis are. This is, you see your classmate sniffling. Do they have the flu? Do they have allergies, or do they have COVID? We don't know because we haven't gotten that far, but we see that they're sniffling, and we can like give them a tissue and we can ask them how they're feeling. This will give us this preventional space of making sure that if it is just allergies, like we get you some allergy meds, but otherwise we can, be okay. Let's say though, then we move to intervention. That's that doctor visit. Okay, this is not allergies, my friend. You have the flu and we need to get you to the doctor's office. But we don't know where the doctor office is until we have an intervention plan. An intervention plan, very much like Ghostbusters, is who you're going to call, like knowing who you're going to call. What is the process? How do we walk you into that doctor's office in a way that feels supported rather than dumped off? That is how we all want to be treated. And that's how I think of mental health intervention. But really, really importantly is we also at the Trevor Project are working on postvention. So that's your doctor's note. After you've gone to the doctor, you may have missed a few classes, you may have missed a few hours at work, and trying to catch up can be really hard. That's why postvention is so important. Prevention, what are those sniffles? Intervention, how do we get you to the doctor? And postvention, do you have your doctor's note so we can support you as you re-enter something after a moment of crisis or a moment of confusion? That is a really short version of what the model school policy does in its simplest forms. You can find it on our website. We are working legislatively to help teachers have the resources. I cannot stress this enough. We have a lot of students who are hurting coming back into classrooms without a process in place. In fact, according to our research, 1/3 of schools across America have no mention of the word suicide in any part of their policies, which means students and teachers are Googling the word suicide when something's coming up, or calling us at the Trevor Project saying, I don't know what to do, but I heard that you may be able to help. Now, we will be there to help, but let's be clear, if we would have had a prevention, intervention, and postvention policy, we would have been much better off. So that's some of the work that we're doing in schools.
Sam, thank you so much. And I'm so glad this webinar is being recorded because I know people are going to want to steal those past few minutes to describe exactly how this works. So thank you for that and for illustrating it so well. Allison, I want to turn to you next. Active Minds is a leader in supporting mental health awareness and education for young adults. And you've seen a lot of success in peer-to-peer club models on college campuses and now on high school campuses as well. Could you speak to the impacts of your program and why you decided to be more intentional about high school expansion?
Yeah, I would be happy to. And how do I follow Sam? I think it's the biggest challenge. And also echoing so much of what my esteemed colleagues have said today. I think you can never start too early. And Active Minds is known for our work in college campuses primarily because, as you said in the intro, I was a college student when I lost my college student age brother to suicide. And so that's what I knew, and that's where we had the opportunity to grow. But recognizing that from the beginning, that this kind of conversation can and should be happening as early as preschool and kindergarten. And the language is different and the words are different that we're using, but at the same time, we can talk about caring and kindness, and we can talk about resiliency, and we can use the word depression with 10-year-olds, with 15-year-olds. We can use the word anxiety with 12-year-olds, and all of those things that we've been so afraid to say. These are experiences that our young adults and our youth are having. And so by not talking about it, we are causing them to retreat even more into themselves. And so we have had a large network of chapters and programs in colleges, and we are more intentionally now going with the support of the Upswing Fund to be working in the high school space, really to both bring our high school, bring our chapter network to high schools, and also to bring the programming that we have seen to be so successful in the college space in high schools. That's going to range from the student-to-student peer interaction. Students are not the ones who are going to be helping each other feel better, but in Sam's presentation, they are the ones who are seeing the sniffles. And if we can get you some emergency, the first day you have sniffles, you may never even need to get to the doctor. You may never even need that doctor's note. And that's the role that youth and young adults and friends can play. We know in the college space that 67% of college students who feel suicidal tell a friend before they tell anybody else. We just don't have that number in the high school space, but we know that that's happening with youth and young adults themselves. I think the other thing that's been so critically important in the work that we've been doing is recognizing that when you first start struggling with your mental health, and Dr. Evans was talking about this, often we're looking at crisis and we're looking down the line, partially because you don't always know when you're not well. It's not, the sniffle, we've been trained to know that that's a cold or that's an illness, but when you start feeling really down, or as a youth, you start losing interest in something that was what's interesting to you, or you feel, ostracized from friends, you don't always know that that's a sign of a more severe mental health challenge, or even that you need and deserve support. And so the opportunity to have peer-based advocacy and awareness and education in the schools really helps youth and young adults know that you're not alone. This isn't your fault. you are struggling and you deserve help and support. So with our chapter model, we're also rolling out curriculum trainings that can go both to educators and administrators themselves, and also to and with students. We also have a training that we created called VAR, Validate, Appreciate, Refer. This is a training that we created actually because an Active Minds chapter in California came to us and said, we are constantly students are constantly coming up to us saying, I have a friend who is struggling, but I don't know what to say to them. And this chapter came to us as a national organization and said, we don't exactly know what to tell them. How can we help people who want to help each other? And that's what we're seeing with the next generation, is that the stigma is lessening, but nobody's really given them the words to use to help support each other. So with VAR, validate somebody's opinions and validate their experiences, appreciate they've shared with you, and refer to skills and support. That may be the counselor, that may be walking them to the counseling center or the guidance office in schools. Maybe that's calling a parent. Maybe it's saying, hey, do you want to go to the mall, or do you want to go for a run, or very basic support before we need to get into that clinical stage. And so that's another program that has been really important for us, and will continue to be really important for us as we roll out within the high school space as well.
Thank you. This next question is for Sam and Allison, because both of you mentioned the youth voice and sort of the importance of young people being engaged here. And, what are both of you hearing from your students, from the students you work with, about how the pandemic has impacted their mental health? And how has this past year really helped you all inform or change your organization's plans or priorities moving forward?
Sam, you want to take that?
Everyone wants to go first.
Sure, I'll start us off, Allison, and then send it over. So, COVID has not impacted everyone the same. And I think it's really important to recognize that even within the LGBTQ community, which is the community that I am generally hearing from and serving, it did not impact everyone the same. So while the things we do hear from LGBTQ youth across the spectrum has been that, virtual learning has not been easy, right? Their support systems were, in general, that GSA meeting that met after Gay Straight Alliance, that Gay Straight Alliance meeting that meets after class. That's not as easy over Zoom because you can't just stop in. There is that one supportive teacher who you would eat lunch with because you didn't feel safe necessarily in other places. You don't get to see them other than through a screen, and they're in their living room, right? There is, of course, a lot of loneliness. A lot of these young people are not out to a single adult at school, but we know that one supportive adult can reduce suicidal ideation by 40%. So again, your literal support system is no longer accessible. But for many folks, it's also been a really great moment. We are having this conversation, and I get to have my pronouns directly on the screen where I'm talking, because that's part of our new norm of culture. And for many youth, that's part of their school system now, that they don't have to out themselves because everyone's doing it. It's just a nice, normal part of society. There's also been a lot of people who are getting to kind of talk about mental health in ways that, while let's be very clear, LGBTQ youth have been struggling way before COVID hit, it kind of was the great equalizer of, oh, you're feeling all of the loneliness, the scare, the fear, you're feeling all that too. And there was this great moment where I think we're starting to have parents and professionals and pastors and peers all saying, yeah, let's take a moment and pause and have this conversation rather than just move on to the next best thing, which, let's be clear, when we just move on to the next best thing, sometimes we leave some people behind, and some of those people are LGBTQ youth. So in general, I would say, as a not great answer, it's a mixed bag. To some, the social isolation has been devastating, and to others, it has been a welcome relief to give them the time to develop outside of an environment that was judging every moment and every pronoun and every outfit. So it's been very mixed.
Thank you, Sam.
And again, I will echo all of that. I think, we all come into this webinar, and I would presume the majority of the people who are here have read all of the statistics and seen everything from the CDC and otherwise. And we know the rates of self-reported rates of depression, anxiety are increasing with our our youth and young adults in this past year. And we're going to continue to learn about that. So there is no question that this year has been extraordinarily difficult. I think I would add a couple of things just for color. One is we sometimes forget that high school age, this is the time that high schoolers are supposed to be asserting their independence and figuring out who they are outside of their parents. And that's just kind of the natural way of life that we all experience. And these high school students right now are forced into their home without their friends and with their family, which again, if it's a supportive family, it sounds wonderful, but it's just against the natural order of growth that so many of us have experienced. And they're really feeling that. And that's where a lot of the depression anxiety is. There's a lot of depression anxiety around academic success and what will my teachers allow me to do, and how can I get the grade, and how can I get into college, and do I need to take those SATs, and what does all of that mean, and what does it mean for my academic pursuits? Those are some of the issues that we're hearing from youth and young adults. The other piece that I would say that we don't talk a lot about is now that everybody is at home, we hear from a lot of youth and young adults who are now doing virtual therapy about not having the space to do it. Yes, maybe they have walls, but they're really afraid of the people on the other side of the walls who can hear them. And so the inability to have your own personal space as a young adult really creates a space of like, can I be me, and can I present myself? And so we will talk often with the youth in our network of, go sit in a car if you need to, or go sit outside if you can, or something, so that you can gain some independence in order to be able to take care of yourself in an environment that feels so kind of insular. The other things that I would add, though, is that we have also heard from youth and young adults that they are reaching out to each other. They are supporting each other, like going back to that peer-to-peer model. I cannot underscore enough how impactful peers can be with each other. And again, not in providing support, but in, hey, how are you doing today? We opened up a Slack network at Active Minds for students, college students at large, high school students at large, to join just to talk about their COVID experiences. And a good portion of the posts are, I need a new Netflix series to watch. What would you recommend? I need something to entertain myself. So it's everything, but all of that is support in the eyes of youth and young adults. We don't have to talk about, here are the signs of depression, but it's really like, I need something to take my mind off of things today, or does somebody want to chat things through? So we're seeing that outreach specifically among peers, which is amazing. We also see a lot of resiliency, and we see a lot of hope. We did a survey at Active Minds in the fall, and one of the things that was just astounding was 78% of students really saw optimism and hope for what the next year and the next couple of years were going to be like. So while it's extraordinarily difficult for so many students, and as Sam said, it's different for everybody, there's also a lot of resiliency in this generation, and an opportunity to kind of look bigger and have hope for the future.
Thank you. The next question I have is for Sharon and Dr. Evans. As Sam and Allison both shared, the pandemic in many ways has exacerbated the existing youth mental health crisis, but also the silver lining is that there's growing awareness and urgency around this issue. And, we've seen a lot of new efforts, alliances, and funding streams that have emerged out of crisis. Could you share some of the emerging opportunities in school mental health currently, and how folks can think about leveraging these offerings?
Happy to. I'll start out with a few points. And, I think to Sam's point, while we know that the pandemic has really exacerbated existing inequities, it has in some ways been this great equalizer around mental health, right? In the sense that many people have, woken up to this idea that stress and loss and grief really impacts mental health, and mental health is essential to our daily functioning. And so, we are at this moment in human history where we have to harness that awareness and really use it as a way to support our children and our families in terms of their mental health. So, in terms of those kind of financing opportunities, resource opportunities, I think we have to think both from this short-term, immediate lens and funding opportunity, and also how do we harness the advocacy, the momentum around that to create long-standing funding mechanisms for school mental health systems. So again, both kind of that relief and recovery funding to support some of those immediate needs, but also some infrastructure supports like data systems for schools that can support mental health identification and triaging, setting? Also, how do you kind of foster some of those school community partnerships right now that could be longstanding? We have to leverage this current opportunity really to ensure that all schools in the US have organizational and individual strategies for teacher well-being, that they have mental health literacy. Allison spoke to some of the programming that they're doing, and many states are leading the way right now. So we can lead, or we can follow those states rather, around mental health literacy, ensuring that all staff and students have exposure, not just in 1 hour ninth grade health class, but starting in kindergarten all the way through. This needs to be woven into our curriculum. There's a lot of movement in social emotional learning, so we should leverage that now. A lot of states and local districts are showing interest in mental health screening, or what some of us are calling well-being checkups in schools. How are we ensuring that we're checking in with students, not just about kind of the pathology, how sad have you been the last 2 weeks? That's important, but also how connected are you, right? Sam spoke of this idea of being connected to one adult in the building. We need to be assessing that and figuring out which students are kind of falling through the cracks, and how can we offer support in the school setting. So those are some of the ideas about how we need to harness this moment in time, but curious to hear from Dr. Evans.
Yeah, well, I love everything you said. What I would add is, I think a big challenge, because I was in public policy for most of my career, and I think a big challenge is how we think about things. And I think when it comes to schools, it really is important to think about it from as an ecosystem, and as a culture, as having a culture. And what you're trying to do, the kinds of things you heard Sharon talking about, Dr. Hoover talking about, is how do you create a culture where these issues are not stigmatized, where people understand them, where there's a basic literacy within the group. I often think, when I used to meet with the school superintendent when I was commissioner, we talked about, we sort of use this image of a pyramid. And at the bottom of the pyramid are sort of the general kids who are, they're doing okay, they have the regular struggles. And you have sort of coming up the pyramid in the middle, you have the kids who might be at greater risk because of, their school environment, all kinds of issues. Then you have at the very top a smaller group of kids who have more significant problems. And as administrators and as policymakers, it's really important to think about all three of those levels. What are the things that we're doing to make sure that the kids who have real significant needs are getting the clinical services that they need? For those kids who are at risk, how do we make sure that those kids, that we can either reduce the risk that they're being exposed to, or at least intervene at the earliest moment? And then for the kids who are generally doing well, how do we help promote good psychological health and good well-being? Something that we don't do much in our field, and it's something that we have to start doing. Most of us think about our diets, we think about what we're going to eat, we think about exercise, and we do those things because what we're trying to do is to stay physically healthy. In the same way, we need to create environments, particularly school environments, where everyone understands what are the correlates of good psychological health. What are the things that I can do that I can that will increase my psychological health? What are the ways that teachers and administrators can do their jobs in a way that will promote good psychological health? Those are things that we already know. And if we can create an ecosystem where schools have the resources to do those kinds of flexible things, I think we are going to have a much better shot at creating the kind of environment and making sure that our children are psychologically well.
That's great. I have a final question for all the speakers before we turn to the Q&A from the audience. And for all of you or any of you who want to respond to this, but as you know, this is the final webinar in a series of briefings to discuss policy solutions that address our nation's mental health and suicide crisis. We have some policymakers and congressional staffers who are attending today or tuning into the recording later. So I want to ask, how is your organization currently engaged in advocacy around policy priorities? And what is your ask for decision makers in government right now? Also, do you have any advocacy tips or strategies to share with the audience today?
Well, I'll start with one of the points that I made, and that is we have to have flexible funding. Most dollars in our mental health systems are tied up into treating illness. And the kinds of things that you heard today in most mental health systems will be really hard to fund. And so I think policymakers really have to understand, when they are allocating money and appropriating money, that administrators need to, one, be encouraged to work upstream, but two, you have to fund systems in a way that give them the ability to do that. So that's number one. Number two, and it was alluded to during the comments earlier, we know that there are various social determinants of our health and of our mental health. We know that housing is a very important social determinant. So if you have children who are homeless, you can do all the therapy you want, they're still going to be very stressed. And so we know that there are other agencies that can help promote health, can address the social determinants that lead to poor mental health. We need to make sure that those agencies are also funding the kinds of things that allow those services to be received by people who might be having these challenges. And often for people in the mental health system, it is often very difficult to get access to those services. And that's something that is really a policy issue that legislators can address.
I love that. Do you folks mind if I go next? Okay, great. Here we go. So to my advocates, I'm going to give you a nice mnemonic of a stoplight. So a red, a yellow, and a green, all of which have policy priorities and how I recommend you do advocacy. Stop the bad, think and review, and then do something good. That's how most advocacy should work, because if you do all three of those things, you'll have a pretty good advocacy program and a pretty good advocacy campaign. Okay, first off is a stop. We haven't mentioned it today, but when it comes to prevention, if I don't mention it, I'm not a good advocate. We have to stop conversion therapy. If you're an LGBTQ young person and you are being told that you should not exist and that your healthcare, your prevention system is actively trying to erase who you are, every organization on this panel definitely agrees with me, that doesn't work, and all it does is harm you. There has still not been a single congressional hearing on conversion therapy in history, and I am ready for us to have this conversation. We have stopped it in 20 states. We still have 30 states to go. This is a bipartisan issue. Okay, I'll get off my soapbox, but stop conversion therapy. You want to actually prevent harm? Stop trying to erase an entire group of people. Okay, second, pause and review. Our yellow light. Our yellow light is about 988. In a couple of years, we're going to, in July of 2022, we're going to have the national system where you're going to be able to call 3 simple digits and get the best kind of intervention, a holistic across the nation. Everyone will have access. You'll see a car accident and think 911. You'll see a mental health moment. You'll have that Allison conversation of like your fellow college student, and you'll say like, hey, let's call 988 together. That's just like everybody else does. That's a pause and review moment because it's not ready yet, but when it is, we need to be ready. And that's why appropriations, as Arthur just mentioned, has to be a part of the system. We have to be ready for 988 by actually actively funding the National Suicide Prevention Lifeline and the specialized services for communities like veterans and LGBTQ youth, which will be needed. Okay, so red, stop conversion therapy. Yellow, wait and review and be ready for 988. And green, good to go. We need every single school district across America to have the resource of the model school policy or another system ready to go with a prevention, intervention, postvention policy. How do we do that? Have the Department of Education put out guidance on this, have a congressional hearing on the model school policy, or introduce legislation. Yes, my legislators, I will happily meet with you. We need every school to have this free resource. This is not even a cost. This free resource in every single school, ready to go so we can save more lives. Stop, yellow, and go. Let's do this together. I realized that made it awful to follow. I realized
awesome. No, it gave us this amazing image that we can follow, Sam. That was great. Okay, I'll jump in with a few ideas. So first, and this is kind of every advocacy message will tell you, use some data, but also use storytelling, right? So, keep things alive for people to remember, right? So some easy data points to remember, right? I'm the psychologist, I'm a data geek, so I'll give you some data points that you can remember, and then you have to match a story that's meaningful for you to this. 1 in 5 youth suffer from a mental health challenge, and this will increase in the context of our COVID pandemic. Most youth, about 2/3, get their mental health supports in schools. That's important. And youth are more likely to start and complete treatment when it's offered in schools. And half of teachers leave the field within 5 years of starting, costing the education system billions of dollars a year. Most teachers report that their own well-being and their lack of support for students' emotional and behavioral challenges is a primary driver to exiting the field. So 3 asks, okay? So you're gonna have your own ask, but these are the 3 that I would ask. First, mental health and well-being has to be central to the mission of schools, and this has to be reflected in how we measure student and school success. So I would ask that however you are adding metrics to your school system, think about how to add well-being metrics, how you assess students and schools to guide intervention, right? Not to be punitive, but to guide interventions for students in schools. Second, most children's mental health challenges will go unmet. We heard that loud and clear from Dr. Evans, and they will go unmet unless we bring those mental health supports directly into schools. And to do this, we need flexible funding. So I'm going to give that second shout out for flexible funding. The funding has to include prevention, early identification, early intervention. Finally, we must take care of our teachers by providing organizational and individual strategies to support their well-being. We can't just keep asking teachers to take better care of themselves in a context of toxic stress. So we have to foster teacher well-being in order to promote positive student mental health. Thanks.
Great. Allison, did you want to go?
Yeah,
Or-
just super quickly, if I can,
Sure.
I would just say, don't forget the young adults and youth themselves. We so often talk about youth and young adult mental health, about what we can do up here to do down to here. But there is a generational shift in how America is approaching mental health. And there is no better proof of that than the growth of Active Minds from 1 chapter when I started it to now we're at over 1,000 schools, all led by youth and young adults who have come to us saying, this is an issue that's important to me, how can I do more? And so embed youth and young adults into your conversations, into your task force, into the funding, support those peer groups, but it's even bigger than just recognizing that it's not what do we do to them and what do we do for them, it's what do we do with them and make sure they are part of it. Active Minds is working with Wellbeing Trust and Young Invincibles to come up with some opportunities for youth and adults themselves to be able to advocate for changes both within their schools and a larger level. We're really excited to roll that out later this year. And all of the work that we're doing, both in involving young adults in the advocacy and also in the policy making that we're doing, just make sure that we recognize just how critical the target population is in being part of the solutions that we're coming up with.
Great. I do want to go to a question in the Q&A or in the chat box right now from Miriam Pearsall. And Miriam says, I'm curious about how parents and families are being incorporated into models for school-based mental health services. It seems essential to bring parents and guardians into the conversation to facilitate healthy environments at home. I'm curious what the speakers think about this. I know that, the family, community, school continuum is really important in comprehensive school mental health systems, but we at Inseparable, we did a couple focus groups last week with high school students, and a lot of them did express concern with seeing that word family there and sort of what that means to different folks. So I'm really curious to hear from you all about ways that you engage with parents and guardians and maybe some challenges or some things that folks should be careful about.
I'll raise one point on that concern. I'll end with the positive, but I'm glad that the young people mentioned concern when it said family, because yeah, especially one of the big parts we have on intervention policy is only give the amount of information that is needed. For example, if a young person is seriously considering suicide and they're going to their guidance counselor or someone else, and it's in part because they're not feeling support, as for example, a young LGBTQ person, you should not be going to the parent and saying they're not getting support as an LGBTQ young person and therefore need this kind of resource, because you may be outing them to their parents, thus creating an even greater havoc at home as a potential challenge. So making sure that parents are brought in with support systems, making sure that a parent has the resources that they can have conversations that are open and conducive without outing or giving away more information than is ever needed. A kind of trust this, again, I love Allison's point, trust the young person to share the amount of information that they need to with their family, because they're getting support hopefully from somewhere, that may be from, again, their coach, their teacher, their professor, or the lunch lady, but they may also be getting it from their parent in a different way, and you don't want to come in between that conversation. Last but not least, I did mention, as in the note to Miriam, we're working specifically with PTA so that the model school policy, if you haven't heard me say it enough, is going to hopefully be raised in every single PTA meeting in the next coming years. Like, that's going to be a big deal, because it will be both the teachers getting the resources that they need to make this happen and supportive, but also parents knowing to ask. We don't know to ask these questions in ways that can be helpful, rather than just, why didn't you save my child? That's a hard moment for a school district. But instead, if we could be doing, as the whole point of this panel, in prevention, we could be saying, what can we be doing to support every young person, including my little one who may be coming to this school?
Could I add something? First of all, I added some resources in the chat about conversion therapy for people who are interested from APA. On this issue, I think it's important to think about it in terms of what's appropriate developmentally. And I think when we're talking about teens, you do want to think about privacy. But for young children, the research is pretty clear. If you don't work with parents with young children, your impact is going to be lessened. And so when you're talking about young children, very important. But as you go up developmentally, the kinds of issues that we've heard are really important.
One thing, I'll stick it in the chat box, but we have a free online mechanism for schools and districts to actually invite students and families to the table to assess their school mental health system. So a few years back, we were charged by the U.S. Department of Health and Human Services to create national performance standards for school mental health. They exist. And we encourage states, districts, and school building teams to come together. We have thousands of schools that have gone in and assessed, how are we doing with school mental health? And at the very front, we ask our schools and districts, make sure that in those conversations, and when you put this call out, it's not just to your school team, your district team, it is to students and families, because they often have very different perceptions of how things are going when it comes to your school mental health system. So I'll go ahead and put that SHAPE system link into the chat box.
That's great. Thank you. Great. Well, we have, I think, time for just one last question. There's two questions in the Q&A box. Donna, I hope that your question was partly answered by Dr. Evans when he talked about homeless youth populations, but I want to maybe talk, I want to maybe talk about this last question. How can we be sure that we are learning and listening from youth populations when developing campaigns? Folks have touched on this, but I wonder if there is, any consultative processes that you see. I know at Inseparable, we're being very sort of explicit about making sure youth voices are being consulted at every step of our campaign development to make sure it's informed by folks. And we're working with partners, organizations like Active Minds and Bring Change to Mind, who are connected with young people, so that we are making sure that we're talking to folks who are, representing young people in this process. But I'm wondering if others have tips or tactics that they've shared or that they want to share about consulting young people in the development of plans.
I could talk for hours. I have 2 minutes, and I want to give others a chance. I will say, don't put kids at the kids' table. So it is not about what you create and then what the youth are saying, and then you try to reconcile it, but ultimately you win. Make sure that youth and young adults are part of your conversations. And again, that's going to look different in every community, every school. Also, make sure it's not just one youth, and it's not just the student government president. There are a number of youth and young adults who are very, very passionate about mental health, many of whom have never led anything before. And actually the first thing they're going to lead is a mental health advocacy group, because it's the first thing they feel empowered to be able to do. So we're not going to tokenize a youth and young person, make sure that they're not representing their entire school or their entire grade, and bring in folks from different identities, bring in the student government president, and also that student who might be in therapy and also wanting to do something with the experiences he or she is having. Bring in somebody who's representing all sorts of different communities within your school, but from the very, very beginning. It's not hard. It's difficult because it's not something we've traditionally done, but to me, like, that needs to change, and that can change because we cannot talk youth mental health without youth in the room actively and not over on the side.
In 5 seconds, I want to also say, and it's slightly controversial, but you need to hear this as well, which is do not expect youth to give you their stories. It is my right to share my story, not your right to hear it. That a lot of this work has to be given as, and Allison expertly said, right? Like giving them power, but not expecting that they take it. There is a huge expectation on young people all the time to give us the solution based on your trauma, and we'll solve that. We'll solve the trauma of the future generations. And to many survivors like myself, no, I would rather not open my heart to you just for you to write a paper. So just recognize that while voices should absolutely be present, they cannot be expected.
Thank you. Thank you to all our speakers. What an absolute delight. I feel so grateful that I got the opportunity to even facilitate this panel. I know that I'll be sending this recording to people in our network and our friends. Thank you so much. And thanks to all the viewers. We'll be sending you the recording and the resources that were shared today as well. So look forward to continuing this conversation with all of you. Thank you. Bye.